So I'm now joined by Melanin Moods. So Melanin Moods is a specialist mental health organization that creates and delivers psychoeducational programs, events, and offers one-to-one therapy. And I'm sure so much more. So I got with me Dr. Chanelle Dennis and Talisa Mesquitta. And if I've pronounced that incorrectly, please let me know. But welcome. So, talk to me about how Melanin Moods came into being and how did you come together and what inspired its creation?
Okay, so Melanin Moods, we registered as a CIC back in 2023, but we had been working together since around about 2020. Yeah, so we started during COVID, when we started doing like online sessions on Instagram and things like that.
When you say online sessions, what do you mean?
So we did a few Instagram lives. Just came up.
Mhm.
Just work with it. We did a few Instagram lives just about mental health in community. And then we kind of saw how well they were received by the community, and that's when we kind of thought, let's make this into something a little bit more.
And just on that comes, it's fascinating. So, do you feel because it was on like Instagram and that because and maybe I mean, you look younger than me, so I'm thinking so I'm assuming that like it is a younger audience you were attracting.
Well, we started originally actually at university.
Mm.
So we did a Black History Month workshop, which was focusing on the 5 steps of wellbeing. And in October, during COVID, that's when we wanted to start with the Instagram lives again. So yeah, it was a younger audience, but I'd say it's a varied audience because everyone was at home. We could do anything, could we? So
I'm just wondering,
yeah.
because I know sometimes, like particularly in our communities, people can be quite insular or protective over things like mental health. But because I'm just wondering if because it was online and because you were younger presenting, that was a reason why they were open to being involved.
Yeah, I think so. I think that's been one of the part of our success as Melanin Moods is that we class ourselves as young people. I don't think I think we technically still class as that. But we're two kind of local inner city girls from Birmingham. We just happen to be qualified in mental health and we're passionate about making a difference in our community.
Amazing.
So I think having that kind of local touch with the community, like actually being from those areas and being quite well known from different families and stuff like that, I think that's helped us to grow Melanin Moods because we are just normal people.
And it goes back to what Tunde, I don't know if you were in the room when he said it, but it goes back to you being the reason why they trust you because you understand me, you look similar to me, you've got a similar sort of background. So I trust you over and above the wider system. Yeah, I hear that. So mental health has long been a complex issue within Black communities. I'm forever still hearing the statistic around Black people being 4 times more likely to be sectioned under the Mental Health Act. Like since I was a child, I've been hearing that statistic. So for listeners who may not understand the background, can you explain some of the key reasons behind this?
Yeah, a lot of it is about the systemic racism that still exists in mental health institutions and the misunderstanding in terms of how Black people may present when they are experiencing mental distress. And there's one story that I share a lot, which for many Black women in the room might know, when you're wearing a weave or a wig, you might pat your hair. And that to us is because we're itching our hair rather than scratching it. And there was a study that found that that was being misinterpreted as a psychotic episode. So it's simple things such as just a misinterpretation of our kind of habits, our behaviors, the way that maybe Black people are a bit more passionate, less vibrant, use their hands, the different kind of cultural, spiritual beliefs that we might have in terms of, even Christianity, Islam, spirits, the speaking of tongues in Christianity, all of that can sometimes be misinterpreted and seen as a mental health issue where it's not necessarily always one.
Yeah.
And just the way that, Black men are viewed and Black men are more likely to enter the mental health services through the criminal justice system. I think that's sometimes just the way that is racism again, because they're more likely to be stopped and searched on the road, more likely to be, they're overpopulated in the prisons. So I think ultimately it is about the systemic racism that still exists in some of the institutions as to why those statistics unfortunately still exist.
I mean, so much is going through my mind as you say all of this, because I'm thinking even just existing in your own skin color and knowing that as you go about on your day-to-day basis through microaggressions, through overt forms of racism, constant reminders that you don't belong, even though, you know, even if you were born here or you've been living here, it doesn't matter how long you've been here, but constantly you don't belong. Even that plays on someone's mind, never mind all some of the more overt forms. It's a lot.
Yeah,
It's a lot. So I know you recently had an event on Sunday. I know you've been busy, so I really appreciate you being here. So you had an event called the Mental Health Marketplace. So tell us a bit more about what that was about, and you know, how did it go?
So we wanted to do something to commemorate and celebrate Black History Month. So Chanelle, it was Chanelle's idea, wanted to bring together all the kind of grassroots organisations within Birmingham who are supporting Black people in the community, whether it's through health and wellbeing, fitness, mental health, any holistic services. So we hired a space. So it was at the Legacy Centre, and we put on an event to just bring everyone together from the community so that people could come and just find out exactly what support there is in Birmingham, whether it's, as I said, to do with your health and their wellbeing, fitness. We had the Children's Society there. We had RSVP there, so that's the Rape and Sexual Violence Project. We had
Children's Trust.
Birmingham Children's Trust. We had a whole load of different services from the community. So yeah, it was like a one-stop shop for Black people to just support themselves.
I think it's really good as well, just as a signposting sort of event, because again, if lots of things happen, especially when it comes to mental health, often people don't know where to go. So yeah,
that was one of the things that people were saying. They weren't aware that there was so much going on within the community because no one really talks to each other, no one communicates, no one. If you don't know what's going on, then you really don't know.
Yeah.
Really good.
The location of that, everything about that event was quite purposeful. So like the location, it was in the city of Birmingham. It's a very well-known location, the Legacy Centre, which traditionally and culturally is always used for those sort of events. It's right in the heart of Birmingham, Aston, which is traditionally, again, a Black and Asian kind of area. We had a DJ, because that's the thing with Melanin Moods events, is always nuance, because we want to actually meet the community where they're at. So if you just say we're doing a mental health event, they might not just turn up. But if you say there's food and there's a DJ, there's going to be a DJ there. There's also, it's not just about learning about mental health, but we're also going to hear some really good performances and some spoken word. It brings people out. So it was a huge success. We were feeling really proud of it.
And it's really important to have that insight, which only, you know, somebody from the community can know. So you've got a fascinating project, or had, called the Black Barbershop Project, in partnership with Public Health Birmingham, which is such a brilliant concept. Talk to us about what that project was and how it was received.
So it's actually called Beyond the Fade. It is a barbershop project, and it is still ongoing. It is coming up to the end of it now, so we are very, very near the end. But we, in Melanin Moods, have a separate program called Barbershop Chronicles, which is a monthly program for Black men to come and talk about different mental health problems. So we partnered with Birmingham City Council and Public Health to create the Beyond the Fade program, which was all about investigating what we know the Black barbershop to be, which is that kind of safe space for men to talk, come and talk. So we had sessions, which was for the Black barbers and for the community that came, and we were asking them about, one, the barbers' perspective on how they think they support the community, what they need to better support the community. And secondly, we spoke to the community to see what they actually thought about the Black barbershop, because we knew that anyway, but we just never did the research behind it. We just knew it. So I think that's what Beyond the Fade was all about, just actually getting that research and evidence behind showing that the barbershop is that space.
It's so fascinating, because again, I remember taking my little brother to the barbershop, and you know, men will say that women like to talk, but men like to talk in those barbershops. But I just wonder, again, because it's around mental health, how easy or difficult was it to get people to open up?
I think, you know what, it was surprisingly quite easy. As we said, we've been doing the Barbershop Chronicles now for over 2 years, and initially we did have some reservations about whether the men would speak, and even on the first session, some of the men came and specifically said to us, I'm not going to talk, but by the end of it, they wouldn't shut. they would not shut up. And, you know, I think that's just testament to how well it's been received, because it's still going and we're still getting attendees.
Amazing.
So, you know, the community want the support.
Yeah.
As I said, it's just about how the support is being delivered. And because it's something that they're familiar with, it's a barbershop, they go there anyway. By us inserting ourselves into that locality, then they're willing to kind of engage with us, and they really enjoy it.
Yeah.
I think what's coming to mind is something that Dr. Tanya Sikaburi said earlier about resources, and you know, because this is so successful, and it would seem a shame that it would just come to an end. So it would be, you know, great to know, even if amongst themselves there's a way of keeping those conversations going.
Yeah, definitely.
Okay, again, I've got to keep it moving, but what would you say to Black workers listening right now? Because we speak to a lot of people who are in organisations experiencing racism and discrimination. So what would you say to Black workers listening right now about taking care of their mental health? What small practical steps can make a real difference?
I think we're both still within the NHS, so I think we are still very much feeling, you know, being in that kind of situation. But it's just about prioritizing your time and making sure that you are having some time out from being surrounded by, you know, the pressures of work. So we always make sure that we have spa days. We have, you know, days out where we just go for drinks or food. So it's about prioritizing your own self-care and making sure that you are scheduling that in.
Yeah. And I always say just accessing those spaces that are for you.
Yeah.
Because I think sometimes that is a difficulty with accessing mental health care, is that you don't necessarily feel like it's going to be the support that you need or in the way that you need. But there are organisations out there which can provide that nuanced support in a way that kind of meets your needs. And I think our event on Sunday really showed that with the variety of services that we had there. So I would say look out for the support that's available for you. Look out for that nuance, either African or Caribbean or whatever your background is, support that's available, and actually talk, because that's one of the things culturally that we have a lot, that you don't talk, or it stays in the house, or it's private, it's our business. But I would encourage people to kind of remove that taboo and stigma of talking and sharing about how you're feeling and actually access the support that you need, because there's some services out there that can do it. Melanin Moods is one of them.
Yeah, absolutely. And finally, mental health often reflects wider inequalities in society, as you've mentioned. So in your view, what would it mean for Birmingham to be an anti-racist city in terms of mental health and well-being? And how can community organisations like yours hold systems accountable?
Yeah. So I feel like there's so much. I feel like I do want to say, I can't remember your name earlier, but he did mention that Birmingham City Council are doing a lot, which I think is really good. But I think it's just the beginning, really, and there's still so much more to do in order to really create services that are anti-racist. Because, you know, systemically and generationally, if that's the correct word, the services were built with white European people in mind. So the models that exist don't necessarily always meet the Black community. So I think, firstly, it takes acceptance that, yes, these models or these ways of working do need to be changed. And then secondly, it's reaching out to the community, because everyone is the expert of their own experiences, and you can't create a service for people without actually involving them in a conversation. So I think that's a really important part of it. And I think training as well, in order for services to develop cultural humility. Birmingham is so diverse, more diverse than it's ever been. And I think a lot of professionals maybe still operate not knowing that, and not necessarily knowing how to meet those diverse communities. So training is going to be absolutely essential. And I think how we as a community can hold them accountable is by demanding change. Wanting change. I don't necessarily mean that's in, you know, it could be simple things like feedback forms. Because we are, as a culture, I'm going to take the Caribbean culture and say, we don't want to fill in any forms, we don't want to fill in any paperwork, we don't want to give our feedback. We will cuss and complain about them, like, but we won't necessarily do anything formal. But that actually makes a difference. We're actually making written feedback and complaining or campaigning to our MPs and actually doing all of that, that's how we begin to actually make a change.
Absolutely. Brilliant. Well, thank you so much for your work.
Yeah.
And thank you for your time today. Thank you. You're welcome. Thank you. Just now. I know you're enjoying the episode, but I've just got to tell you this. If you're wanting your organisation to transform with regards to diversity and inclusion, you need to check out our Crafting Compassionate Cultures online learning hub. It includes our 4 CPD accredited online courses, including one around anti-racism, microaggressions, sexual harassment, DEI, and more to come. It includes team leader packs so you can have discussions with team members about the learning, our HR integration toolkit so you know exactly how to roll out this program, and it's got email templates and more, certificates of completion, monthly learning reports, a monthly expert-led Q&A, and bite-sized videos, and so much more. Want to find out more and to trial it for 1 day free of charge, no questions asked? Visit our website www.strawberrywords.co.uk. That's strawberrywords.co.uk. Now back to your episode. And I think that last point again is really key. Consultations, often they come about, we get these emails and often we think, sure, I am Kiamada. Or, you know, but again, if we don't take the time to participate, then how can we be a part of that change? So I think it's a really key point. And so now I bring on my final guest. And we've been talking really, really quickly, so we can chill a little bit. Okay, who is Sipho Ndlovu? You're going to correct me. We've been working together for years and I still mispronounce your name, so please help me. Sipho is an associate trainer at Strawberry Words. So as we mentioned earlier, Strawberry Words worked in partnership with Public Health Birmingham to design and deliver cultural humility and safety training for 246 people across the council and for NHS partners. We also trained 52 people to become trainers. So there were 3 practitioners that delivered this work. So you'll have seen earlier on, Dr. Naomi Alamele, who's just had a baby. Sipho is one of those people, and also, I can't interview myself, so I brought Sipho here to have a chat about this. So, Sipho, oh, by the way, can we all say happy birthday, because it was his birthday yesterday?
Gracias, Tapio.
So, you played a key role in delivering the cultural humility and safety training over the past year. How would you describe what this program set out to achieve, and what has it meant to you personally?
Yeah, first of all, I'm so excited to be here.
Yeah.
I must say, but I absolutely still remember when this opportunity came up to deliver this training, because we know the impact and the possibility of the impact of having these types of conversations across industries and face to face. So when I found out that there was a 2 huge local authorities that had collaborated because there was a similar demographic to address health inequalities, and such training as cultural humility on the basis of people, professionals coming to terms with what it is that they do and who they are and why they do what they do and where that comes from, and us having an opportunity to just facilitate those conversations. That's what I knew that the role was about.
Yeah.
And coincidentally and ironically, not about approaching it from an expert mindset, but just stepping in and saying, we're going to have some really relevant conversations. So that's what I thought we would do it. That's what we did. But also that's what I was looking forward to.
Yeah. And on that point, I want to say, another feature of cultural humility is, you don't have to have that pressure of knowing everything. And we say that to people, like, you're constantly on this lifelong journey. So you're going to, you don't have, and I think as trainers, that really helped us actually, because we're like, okay, this is quite a new concept to us. Like, we know anti-racism, that's what we do. Cultural humility, okay, but we're learning as we go along. But oh yeah, it's okay not to know straight away. I'm going to find out if I don't know, but it's okay. And it just really eases that pressure. And also when you're delivering it to others, people also feel as though, oh, good, I wasn't necessarily meant to know the answer. Although I'm going to keep learning, but don't have to know it right now. Brilliant. I love it. Anyway, you're really passionate about it. So, right. So we had quite a bit of fun envisioning the training program. So please share with the audience some of the ideas we had in ensuring a psychologically safe environment and ensuring it was interactive and non-threatening.
Absolutely. So play became a huge feature when we were devising and designing the content, but then in the room as well. Although we are having conversations that have impact on people's lives, we discussed play. So, for example, we had real life example scenarios between service providers and service users, so the communities. And as trainers and trainees, we would be in that room exploring those scenarios and practicing how to approach different circumstances from a culturally humble point of view. So in other terms, it's role playing. And this is scary for a lot of people. It's a moment to roll your eyes. But actually, it's so effective because what is it that you are afraid of in that moment? And we knew we wanted to create a non-judgmental space. Yeah. But then we also addressed that. What is it that you are afraid of being judged on? If you are talking about other communities, either as part of your role, as part of the scenario, how do you then feel in that moment? And all of that is relevant as part of the work you're doing, because why are you feeling awkward about it, or maybe the language and the terminology? So play provided us that opportunity to find our humanity in this work, and loads came out of that.
And you came up with the idea. So we had a map where we had people, you know, we were speaking about where people come from. So really exploring our own cultures, and you had people put stickers on where they feel they belong. Was that it?
Yes.
And that was, you know, that was an interesting interactive way to look at, you know, how people feel about how they class themselves. There were quite a few conversations about that.
Absolutely.
Yeah. And I mean, we did really have a fun time coming up with exercises. I think, again, you may have come up with the idea of the love cards, or somebody did. And really just wanted people. So our love cards are just basically cards that this size, and they had various messages on them to help people feel at ease when they came into the room. The music was very purposeful. At one point, we spoke about having what do you call them? The fragrances.
Different scents.
Yeah. Because we really wanted people to feel safe in the space. So we had fun with that. So participants describe, feeling in the evaluations, feeling real shifts in awareness and behaviour, even changing how they engage with colleagues and communities. So what changes stood out to you most as a trainer during those sessions?
Yeah, so as a trainer, I got so much insight into various departments in the council and different trusts as well. So I was just observing so much. And I think when you enter the workforce, and I still reflect on this as a young person, I guess, and just something about what you're told about and what you can expect when you go through the education system, then you finally enter work, and how you are supposed to be engaging with the people. And there's a way to talk to others. But I think in work environments where you're meeting with so many people and communities on a daily basis, it becomes really important then to know how to talk to them. But we live in a very complicated culture and society where nuance hasn't always been allowed or encouraged. And so therefore it can be a privilege to live in a multicultural society such as is Birmingham, because you learn these things when you're on Soho Road, when you're on a certain bus route, when you get invited around to people's homes.
Soho.
However, if you haven't organically come across some of these experiences, and the first time you're interacting with people from various cultures is within your workplace, questions come to mind. And if your approach then is from a professional standpoint, and as well as one, how can I make sure I don't get in trouble? Then already there's barriers and limits there to just interacting on a human basis and asking questions. And so it was those moments, long story short, it was those moments I was noticing us in a room working together, and people would open up about how to talk to colleagues. Just as far as I have questions, but I'm going to start because I don't want to offend you. How do I go about this?
Yeah.
And sometimes there can be problems from that as well, when the simple thing can just be say what you don't know instead of making those assumptions. So that's where I saw those very brave steps that people were taking forward, actually.
So on that note, because you work closely with people learning to deliver CHS, or cultural humility and safety training sessions, what did you notice about their journeys and their challenges, their breakthroughs, and the kind of growth that they went through?
Yes, again, really enjoyed observing what happened here. So one key point was about people who identify as white English. Whenever we spoke about culture, it became very, very difficult to understand what we were talking about, and nuance almost left the room. And what we started to talk about was the legacy of understanding. And we came to terms with that culture had always been defined for us, as far as thinking that culture is something that anyone who isn't white has or does. It's the food that they eat. It's the way that they walk, the way that they talk. But white English people don't have culture. So as potential trainers for culture, humility and safety, this was a very open and honest conversation that we had a lot of time, where people would ask, how do I deliver this training when I could potentially be seen as problematic? And so we had that conversation and what that was all around, and debunking some myths and actually understanding that one, we all have a culture, not only on a broader social perspective, but within your own household, you have a culture. It will look very different to someone else. And so a lot of what people will be fighting within the work environment is based on prejudice. But we address this by actually talking and engaging with one another. So it wasn't easy at all. But I really did applaud all the trainers and how they opened up.
Yeah, it was quite a bit of a challenge for us, really, when we thought about it, because a lot of what we take a lot for granted in terms of training delivery. We then had to explain how you have this difficult conversation, or how you work around that concept, as you said. So one of the strongest messages from the final report is that humility is not a weakness, but it's a strength. So how do you see that play out in leadership and in everyday professional life?
Yeah, so what comes to mind there is talking about liability, actually. So we love work, right? Going to work. Yeah, this is great. The type of world we're living in. And when you are representing an organization, and the media might be ready to find an issue with your workplace and therefore catch you out, or even more closer to you, you're afraid of getting so in trouble that you're disciplined, but potentially lose your job. So the sense of liability coming in the way when you possibly have an opportunity to talk directly and openly to a service user, to a member of the community, especially when it's important to say you're sorry, or say that you don't know.
Can you use an example so people understand? Because I know what you're talking about. But can you use an example so people are crystal clear on what you mean by that? So give an example of how somebody might start to think, actually, I don't want to be liable, therefore I'm not really going to say something to help that person.
Absolutely. So I can talk about it from a housing point of view. So if you work within housing, within a local authority, and you have a member of the community who's been housed, and you're engaging with that person on a case, and let's say, for example, English isn't their first language, so as part of that, understanding the processes, and going through a local council. But what was said initially, maybe things have changed because processes change, and sometimes the people who are in those systems are the last to find out. So then all of a sudden there's an update, we have to move you. And when those members of communities are asking, but why? Why is this happening now? Why didn't you tell me before? I have children, all these other things. And the person that they might be dealing with, the last thing they ever think to say is sorry, or just fully explain what has happened, and just understanding that if I was in your shoes, I'll be just as upset as you are. But instead, it's, hey, it's not my fault. It's no one's fault. This is just the system. And when you're hearing that as just a person on an everyday basis, when you've also got things to do, it's very disheartening.
It's also, I'm thinking, the line, I'm sorry you feel that way.
Mm-hmm.
Yeah. Yeah.
Yeah, exactly. And that it's not my fault. Which when you're in a position of authority and power and offering a service, that isn't always even the question that, like, it's not like your fault, but you're the one who can potentially help, but it seems like you're not. It's just those types of conversations there.
Absolutely. So every initiative of this kind faces challenges, and we've spoken about a few today. What were some of the most difficult moments during delivery, and what did you personally learn from navigating them?
So for me personally, it was reminding myself that I am not an expert. So as a trainer in that room, I had to come to terms from a humble point of view of my position of but position of authority and power in that room. Ironically, a lot of the times I'll be the youngest in the room. I might be, I'll just come to terms with that. I'm a black male as well, the delivering. And for others, this might not be important, but it's important for me. Because I know how I might come across as far as my hair, as far as how I walk, any colloquialisms I use. So all this was important to me. And so when delivering the training, when questions were coming up about culture and would start to veer towards black culture as well, just me sharing that I'm not an expert in this in particular. And this isn't necessarily why I'm in the room. Just differentiating between facilitating and giving a talk right on a specialist subject. And so those moments of holding those moments where I'm about to lean into a certain voice where, let me tell you what I know because I'm this intelligent guy, but actually it's can we work this out together? And I guess trying to model that culturally humble approach.
Yeah, absolutely. I mean, I think it has been really transformational for us as individuals, developing embodying cultural humility. It's been fascinating. So, Nelida, we've been instrumental in helping people understand that cultural humility is that continuous journey. What does a culturally humble workforce and city look like to you? And how do we sustain that mindset beyond the training room?
Yeah, very, very complicated question, very complex. But I think one of my examples I use often when I would travel towards a room or the council house where we deliver training, I'd have to walk past or walk through a train station, so Grand Central train station. I've got a bit of time, so I'm walking into Greg's first of all, and I'm picking up food. Now it's very early in the morning. There's already a long queue, and everyone is very, very busy going to their very important jobs. So who deserves to be served first? Who should get that porridge or that pastry? And everyone has something to do. But I remember reflecting in those moments about the training that I was about to go and deliver because it's a rush hour in the morning, and I've already been nudged 3 times. So where is my temperament at this moment? But me just acknowledging what's actually going on for me, what happened the night before, anything else, because this is all in the lead up to me saying what I want from the person in Greg's, because I'm about to address a human being. I'm not just addressing someone who works for a corporation, and I'm not someone who's on my way to an important job. So I think wider society, knowing who it is that we are addressing most of the time, and looking beyond any status symbols. But this is incredibly hard to do. We're so hardwired to judge. But when you know better, you do better. So these are some of the seeds I think this training plants in a wider society.
Thank you so much. If you could, I haven't asked you this before, but I think it's so valuable, and I know you could give a really lovely answer at no pressure. Yeah, if you could share one element of cultural humility that you think will help people along their journey, what would that be?
Yes. So I think it's really important to remember that you yourself are a very significant individual. And this is by your lived experience. And therefore, everything that you are now and who you have become hasn't just been through a very polished practicing, but it's due to a lot of mistakes. And most importantly, it might be mistakes that you'd made that no one else had made, no one else had acknowledged, but you were able to provide yourself grace and space to move past, so you can become the successful and safe and loved person that you are. And already, whatever stage you are at in your life, knowing that you never stop living, being a human being, you will absolutely continue. I have learned so much in my years, and I know there'll be more mistakes I will continue to make. But the difference is that I'll give myself grace, whether I want to or not. I will find it. So offering that to others, especially colleagues, especially within our work environments and our communities as well, just in building. And I think it all comes back to what culture, humility, and safety is about, and that it's a lifelong learning. So everyone knew, as part of our training, that they weren't going to attend it and then it's a tick and well done. You're culturally humble.
Yeah.
You continue to practice.
Yeah. Oh, I love that. See, I knew you could see it. Thank you so much, Sipho. It's always a pleasure working with you, and it's been fascinating speaking to you on this level. So thank you so much.
My pleasure. Thank you so much.
Right.
Thank you. Yes.
So that brings us to the end of the podcast recording, and hopefully you've, as listeners, you've taken away some real golden nuggets there. What kept coming up and what I kept hearing was this thing about trust, that in order to have any sort of type of real engagement and real impact within diverse, particularly Black and African Caribbean communities in this context, you've got to have trust. And having deep engagement partners such as Illyria Health, such as Melanin Moods, having people from the community who understand the needs, who are reflective of that community, is incredibly important. But also there's the aspect or the framework of cultural humility. I think it really offers all of us the opportunity, a kind of an easier way into having difficult conversations, because we have to have these conversations, but too often people are like, it's too much. But cultural humility, it just eases you in to having these tricky conversations. And so if you're listening and you're from, you're often people who listen to this podcast are really people who want to do the work to create change. I'd say really lean into and learn more about cultural humility, because it is a tool that you can use to help bring people into these conversations, to help people to listen and not feel so defensive and feeling as though I can't participate. So back to my script, cultural humility reminds us that learning is lifelong, and that each of us has a role to play in dismantling barriers and creating spaces where everyone feels seen, respected and valued. So as Birmingham continues its journey towards being an anti-racist city, let's remember that this progress begins within, as Sipho was saying, with the choices we make, the conversations we have, particularly in these times, taking care of ourselves, as Melanin Moods has said, and the compassion that we bring to our work each day. So I'm Rebbecca Hemmings. This has been Compassionate Cultures. Thank you so much for listening and for being a part of this movement to create a more equitable future for all. Thank you.